Florida Healthcare Association. Welcome, you're recognized.
Good morning. Thank you, Chairman, Vice Chair, and members of the committee. I'm Deborah Franklin, the Senior Director of Quality Affairs for Florida Healthcare Association. We represent approximately 84% of the state's nursing centers and about 100 assisted living facilities. Thank you so much for this opportunity to provide an update on the heroic work of our long-term care providers throughout this pandemic, especially during this recent Delta surge. Florida's nursing centers have put forth a tremendous efforts to keep both their residents and staff safe since the beginning of the pandemic, and they continue to do so. They have maintained their infection control protocols, and staff are still wearing masks, are conducting regular testing every day, screening before entry, which includes temperatures, and have been able to mitigate spread through the use of COVID isolation wings. Facilities are better managing the virus, and the data is already showing a downward trend in cases. Nursing homes are reporting COVID-19 data, including cases and vaccination rates, into the CDC National Healthcare Safety Network. That data is made available to the public, and it's updated weekly. As of the week ending September 26, cases in our care center have significantly declined. And today, I'm happy to report that more than 99% of the residents and staff remain COVID-free. Regarding vaccinations, Florida's nursing centers continue to make progress, with over 53% of our staff being vaccinated. Our centers are doing everything in their power to encourage staff to get vaccinated, including offering financial incentives, and staff vaccination rates are improving, if more slowly than we would prefer. Much of the hesitancy we're seeing in staff is the same hesitancy that we are seeing in our communities, where a portion of the population remains hesitant to get vaccinated. Just like COVID case stated, vaccination rates are made available publicly by federal CMS Nursing Home Compare website. Individuals can search the facility to review those vaccine rates, similar to how they check a center star rating for quality of care. In addition to COVID vaccinations, facilities are also looking at the use of monoclonal antibodies to help residents and staff recover from the virus. In September, Florida Healthcare Association partnered with the Agency for Healthcare Administration, Department of Health, and the Division of Emergency Management to host a webinar for nursing home and assisted living providers to educate them about the governor's initiative to make monoclonal antibody treatment sites available across the state, with a specific focus on long-term care residents and staff. Experts from these agencies provided an in-depth Q&A to help participants understand how this treatment works, the side effects, and how they interrelate with vaccinations, etc. It's been extremely well received. With that, many of our providers stepped up to the plate and started using monoclonal treatments. I'm going to give you two short examples. You heard from Department of Health, there were 50 long-term care facilities that the strike team went into. In addition to that, many of the facilities work directly with their long-term care pharmacy providers to do the infusions. One example, a company had a COVID unit and that had positive cases. 29 of those positive cases received monoclonal antibodies, recovered safely in the facility, did not have to go to the hospital, and received no side effects. In addition, another facility had an outbreak in a memory care. A memory care resident is very hard. You do not want, transfer trauma is extremely hard for them. They were able to use the monoclonal antibodies, and all of those memory care residents were able to stay into their home and not have to go to the hospital, recovered with no side effects. Facilities are also making plans to handle the third shot vaccine boosters for residents. We've shared a survey with our members to gather data for the agency and the Department of Health to help inform the state how these booster shots are being made available to the residents. Plans to deliver those boosters will be just like what was done when the vaccines first became available to the residents, with facilities partnering with their long-term care pharmacies to bring the boosters on site so residents don't have to leave the facility. We know that the vaccine is the most effective way to keep our residents safe, and we remain focused on increasing our uptake rates. There are concerns, however, that the federal mandate could impact long-term care labor crisis that we're currently experiencing. And I use the term crisis because there's no better word to describe the situation our care centers are in. In July, Florida Healthcare Association conducted a survey of our members to identify their pain points and how they've been working to address their workforce challenges. The results were alarming. 88% of the workforce 88% said their workforce situation has gotten worse since 2020. 74% were forced to use temporary staff through an agency at least once to fill shifts. 52% of nursing homes have had to reduce admissions because of staffing challenges. That could cause a serious access issue. 63% said their budget cannot sustain current efforts to meet the staffing needs for more than 6 months. 58% said they are paying unsustainably higher rates for the staff than they can manage to recruit. 59% said their facilities are operating at a loss or negative total margin, while another 19% are operating on a total margin of no more than 3%. As you heard the Hospital Association talk about the staffing, we're all fighting for the same staff because of the critical shortage. The measures taken by our long-term care providers to deal with the workforce and COVID crisis has greatly impacted their bottom line, affecting both the opportunities to recruit and retain staff and their ability to provide essential care to residents. Providers spent and continue to spend hundreds of thousands of dollars on personal protective equipment and staffing to care for and protect our residents and our frontline workers. Costs per patient day are up almost $42 per day compared to the pre-pandemic time period, resulting in an additional cost to the profession of $660 million annually. Staffing has been our top cost in response to fighting COVID-19 and meeting the residents' care needs. Facilities have seen a 21% increase in direct care staff costs resulting from paying overtime, contract labor, heroes pay, and other added benefits and hiring additional in-house staff. That's an additional $300 million in direct care expenses that facilities are experiencing on an annual basis. Facilities' use of employment agencies to fill vacancy is up by nearly 250%. Just as important is the fact that agency staff don't get to know the day-to-day needs of their residents, and they lack the consistency in direct care workers that affects the residents' quality care and quality of life. While we are encouraged by the progress we've made in our fight against COVID-19, the pandemic has caused a workforce and an economic crisis that we can't resolve on our own. We look forward to working with the legislature in the upcoming session on solutions to further support our long-term care centers, their frontline caregivers, and the residents entrusted to our care. Thank you.
Members, any questions? Senator Book, Leader Book, you're recognized.
Thank you, Mr. Chair. I just was hoping that, first of all, thank you for the work that you're doing every day at the long-term care facilities. That's important and the most essential. But I was hoping that you could just circulate some of the statistics that you cited, just like the $42 a day, where those are, so that we can kind of continue to track those as we go on and look at, issues that may come before us, just so that we have them.
Absolutely, we'll get that to the committee.
Thank you. Questions? Seeing no questions, thank you very much. Thank you for your update. Thank you for being here.
Thank you.
Next, Senators, we have